Hello, everybody. My name is Cristiane. I'm a kinesiologist with Simply Health Solutions, and today I wanted to talk about 5 different exercises that help prevent falls in those 60 and over. Obviously, this advice can be helpful for potentially anybody who's got any sort of balance issues, but they do find that once we reach the age of 60, we are at an increased risk of having falls. So it's always good to kind of have this sort of stuff in the back of our minds. So falls deserve our attention because it can cause quite a few problems down the road. Falls are quite common after we turn 60, but the thing is like it's not inevitable. A lot of people seem to think that just because we're getting older, certain things like memory issues and loss of strength and loss of balance and all this stuff is just like an inevitable part of aging. But it doesn't necessarily have to be. And the thing is, knowing our risks is going to be that first step to staying steady and keeping our balance. About 1 in 4 adults over the age of 65 have a fall each year. And this doesn't necessarily have to be like a hospital visit, doesn't have to necessarily result in a big injury, but it is going to be where those tumbles can start adding up after a while. Unfortunately, it's the number one cause of injury-related deaths in older adults, partially just because the fall itself can cause certain injuries that can end up causing quite a few complications down the road. So I think about people who maybe fall down and hit their head, and then that can cause issues with our brains. Or maybe they fell down and broke their hip, and now the hip replacement surgery, the emergency hip replacement surgery can cause issues, and then it unfortunately spirals after a while. So it is something to keep in mind. And unfortunately, having a single fall doubles the odds of falling again. So it is something, again, to kind of keep in mind that you do want to work on your balance as much as you can. The good news is exercise has been really shown to be helpful. Up to 35 to 40% fewer falls for older adults who are participating in some sort of structured strength and balance program. That doesn't necessarily mean it's some sort of expensive gym program. It can be something you're doing at home. It could be something you're doing maybe with friends, just going to the park and doing some exercises there or at your kitchen sink. Doesn't have to be anything too crazy, but it is important to try to include exercise in your everyday life. Across various different studies, they have found, people who exercise regularly have 15% fewer falls, 16% fewer injurious falls, and it is officially recommended. Exercise is the intervention national guidelines endorsed to prevent falls. That's going to be kind of like the number one thing. There are always going to be a case-by-case basis of different things we want to look at, such as nutrition, hydration, maybe medications, maybe different conditions, health conditions that you're going through. But in almost every case, exercise is going to be helpful in some fashion. I've worked as a kinesiologist for almost 10 years now, and I've never met anybody who wouldn't benefit from exercise. It's just going to be a matter of what kind of exercise, what intensity, maybe some risks we're looking at to just try to make sure everybody's staying safe. But it is going to be something that's important to look at. And it doesn't have to be anything too crazy. Even just 2 or 3 sessions a week can be really, really helpful. And just making sure we are working on our balance and our strength. So those two factors are going to be something we want to keep in mind. So there are a number of different exercises that can be helpful. I always say to make sure you're not doing the exact same exercises every single day. I've had clients who essentially did that, where like for years they basically followed the exact same exercise program. And you wind up missing out on different muscle groups if you're doing kind of the exact same exercises because no one exercise routine is going to get absolutely everything. But these five are going to be a really good starting point, especially for those who maybe haven't exercised in a while. Maybe this is something new to you. Maybe this is something you're just looking to get started. So it is something that's a good starting point. As always, make sure you're checking with your doctor or a physio or a kinesiologist or somebody just to make sure that you're okay to get started. And to also let you know if there's anything that you should be keeping in mind or if there's any kind of particular modification for each of these exercises. If for whatever's kind of going on in your health or if there's any other mitigating factors that you should keep in mind. So the first one is the sit to stand. This one I pretty much tell everybody if you're only ever going to do one exercise, I highly recommend you do the sit to stand. It is so important for your everyday life, and you'd be shocked at how much your life changes once you no longer can get out of a chair by yourself. And unfortunately, like other things, this kind of sneaks up on you. And like the loss of strength really sneaks up on you because at first it's you're able to get out of a chair by yourself. Over time, maybe now you're using your hands to get up. Over time, you're needing to only sit in raised chairs. If you sit in a low chair, you get really stuck. Then pretty soon you need like a table or a railing or somebody to help you up. So it is one of those things that does start to sneak up on you. So you do want to work on it as much as you can. And then, so when it comes to the sit to stand, the idea is you want to sit tall. On a very sturdy chair, I often recommend have that chair like up against a wall, just in case the chair slides away from you. So you do want to keep that in mind. You want to keep your feet flat, your hips wide apart, and you do want to make sure your knees are kind of in good alignment. A lot of people have a tendency to have their knees fall inwards. And then you're going to lean your chest slightly over your toes. Sometimes we say, you have your nose over your toes, and you're going to press through your heels and then stand up slowly, then lowering back with control. So the idea is you want to fully stand up and you want to slowly come back to your chair. So a lot of people have a tendency to only go halfway up and then basically fall into their chair. So you do want to keep that in mind. Make sure you got good shoes. Make sure you got good support. Like maybe if you need a table in front of you, feel free. Always make sure you're as safe as possible. In any sort of balance exercise, I always recommend you never give up safety when you're working on your balance. Couple of, one recommendation, you could try to do this 10 to 12 times, about 2 to 3 times a week, and you can start there and then just see how you feel. Because if you haven't exercised in a while, you'd be surprised how sore you can get the next day. And sometimes the day of, you actually feel fine. It's the next day that you really start to feel it. So do keep that in mind. And essentially, the reason for this is that it builds leg and hip strength that you use to stand up, that you use to climb stairs, and to catch yourself if you ever lose your balance. So it is going to be a very, very important exercise to keep up. Then we've got the single leg balance. So, the idea of stand near a counter or a sturdy chair for light support. You're going to lift one foot a few inches off of the floor, kneeling with your knee softly bent. And then you hold it, and it's going to be totally up to you what you can tolerate. You can hold up to 30 seconds, and then you switch with the other leg. And again, to kind of start, you can do maybe 3 holds per leg and do that most days. Personally, what I really like to do with especially these types of exercises that you're trying to just sneak in throughout the day is thinking about can you add this exercise to pretty much any time you do something relatively regularly. So I think about maybe every time you finish brushing your teeth, this is something you do at the counter. Just so that it's something that you're doing on a regular basis. And the idea is you're training your balance reactions that keep you upright on uneven ground. So it is going to be that what happens with a lot of people, and you might notice this when you start, is one leg might be significantly stronger than the other, and you might find that you really favor one side over the other. I do that myself. It actually led to a little bit of an injury several months ago. And it's something that even I didn't realize how much I favor one leg over the other. So it is something to keep in mind, especially if you've had a stroke or a hip replacement, or you just have something that causes pain on the one side. So you do want to keep that in mind. Then we've got heel to toe walking. So essentially, what you're doing is you're going to look straight ahead, extend your arms out for balance. Um, step one, step so that one heel lands just in front of the opposite foot. And basically walking as if you're walking on a tightrope. And the idea is you're taking slow steps. The irony is with certain balance exercises, actually, if you go faster, it might seem like your balance is actually really, really good. But it's actually just because your body's really good at using momentum. So you do want to kind of take your time with it. And again, maybe 2, 3 walks daily. Do make sure you're near a wall so that if you lose your balance, you've got something to hold on to. Or maybe like I know certain people in their homes, you might have like a straight railing or something to hold on to, or a kitchen counter. Just make sure you've got something whenever you're doing balance exercises to stay safe. This helps to sharpen the coordination and the steadiness you rely on for everyday walking. You'd be surprised that even just bringing your feet a little bit closer when you're walking actually does challenge it. Some people have a tendency to have a little bit more of like a slightly wider or having their feet a little bit wide when they walk, and they don't actually realize it until maybe somebody like me asks them to bring it a little bit closer, and then suddenly they realize that their balance is kind of off. So you do want to keep that in mind. Wall push-ups. So a lot of people wouldn't really think of this when they think of balance exercises, but it actually can be helpful. The idea is you find a wall, stand about an arm's length from a wall. Again, kind of depends on the individual, closer, farther, just as long as you're getting a challenge. Have your palms flat at about shoulder height. If you've got shoulder issues, right? So just do what feels comfortable. The idea is you're bending your elbows to lean forward, and do it slowly. So do make sure you take your time with it. Some people kind of speed through it, and then again, you're kind of using momentum, and you might not go as far down as you are able to if you're going really fast. And then you're going to push back slowly to straighten the arms, and then you're essentially doing a couple of push-ups at the wall. Make sure you've got good shoes. Make sure you've got good support so that you don't slip while you're doing this exercise. And you can do, again, maybe about 10 reps twice a week. Start there, see how you feel, and then slowly work your way up. And for this specifically, the idea is as you get better and better, you're able to get slower and lower and lower to the ground. So maybe you start with wall push-ups, then eventually you're down to like a chair push-up, then working down to you're on the floor on your knees, push-up, and then eventually you're doing a full push-up. And the idea or the benefit of this is that you're helping build upper body strength to push up from a chair, or if you're actually completely on the ground and now you're trying to push yourself up. So it's something that I really work on with people in my in-person balance group, where we really practice. People always kind of look kind of nervous when I tell them that's like, yeah, at the end of this program, we're going to practice getting down to the ground and back up. And people always look at me and it's like, oh, there's no way I could do that. But the thing is if you have a fall at home and there's nobody around, you're going to have to figure it out anyway. So it's always good to do it while there's other people around who can help you and can help problem solve. Now, if you ever have a fall and you try to get up and you feel like a sharp pain, make sure you don't kind of push through it because it could mean that you've injured yourself. So you do want to keep that in mind. You do want to like take your time with it. And then if you have hurt yourself, at that point, if you can like maybe try to like slide yourself to a phone and call 911 because if you try to get up on maybe like a slightly fractured hip or a slightly fractured bone, you could make things a lot worse. Whereas if the ambulance and doctors are able to intervene early, less likely of a bigger injury. Then we've got heel raises. So the idea of you stand at a chair or at your kitchen counter. And the idea is you're getting up on your heels and then you lift up on your toes and you're basically rocking back and forth. This is going to be really, really helpful. Make sure you are like slowly coming down when you bring your heels down, and take control when you bring your toes up. A lot of people, they tend to kind of stick their bums out when they lift their toes. You do want to kind of make sure you're standing up nice and tall, so that your body's not compensating. And you could do about 10 to 15 reps, 2 to 3 times a week. Again, maybe at your kitchen counter or your bathroom sink. And the idea is you're strengthening your ankles and your calves to stabilize every time you take a step. So a lot of times we don't realize how important our feet are in our everyday balance. And especially, I really do love the raising of the toes because the thing is if that particular muscle that lifts your toes is starting to get really weak, you'd be surprised how easy it can be to slightly trip over the smallest little thing. Like even like I've seen clients trip over carpets just because they didn't lift their toes high enough. And the idea is you want to make this consistent, right? So sometimes people, they're what we call weekend warriors. So they, maybe they do like 30 minutes, even an hour of exercise, like on a Saturday, but then kind of completely forget to do it the rest of the week. You're better off doing a little bit every day than to try to do a ton of exercise all at once, but then not keeping up with it. So, if this is all new to you, you can always start with 2 to 3 days a week of strength and balance training and work through these 5 basic movements on maybe non-consecutive days, especially if you're having like muscle soreness. Maybe you do want to give yourself a day in between. The overall recommendation is to work up to 150 minutes of exercise per week, and this can be in 10-minute chunks. It does not have to be an hour, doesn't even have to be 30 minutes. It can be 10-minute chunks. Just finding ways to kind of sneak those in kind of throughout your week. And then the other thing is making sure we're doing it on a weekly basis and on a regular basis. So make sure we keep practicing. Progress gently, add reps or use less support over time. And you do want to just, especially if you're doing this on your own, you do want to kind of take your time with it when you are slowly increasing, especially if you've got any sort of other kind of medical things going on. So you do want to keep that in mind. And then just a few gentle reminders. Make sure you're checking in with your doctor, or physio or kinesiologist, especially if your balance feels unsteady. So if you feel like there's something wrong, I would recommend kind of checking in. Keep a sturdy chair or a counter within reach as you build your confidence. And especially if your balance is particularly challenging, I wouldn't even recommend a chair. I really would recommend that counter because the idea is if you start to really lose your balance, the chair is going to slide away from you, or the chair is just going to go down to the ground with you. So a counter is going to be a little bit more sturdy, especially at the beginning. Make sure you're wearing supportive, non-slip shoes, and clear away any tripping hazards. So, making sure the floor isn't wet. I know sometimes people they have maybe little dogs or cats, and the animals like to stay around your feet. Do be mindful of them and make sure you don't trip over them. And then make sure you do stop and feel and rest if you do feel dizzy. And if you do feel any sort of major negative symptoms, again, do check in with your doctor, check in with somebody. You don't want to just keep pushing through, especially there are just like a couple of different red flags that we know of that you do want to just be mindful of. Um, and the thing is, at the end of the day, I mean, every rep is an investment in your independence. So, you know what? I would just say do what you can. And I love this idea of, what you can do, do often. So, whatever you can do, you'd be shocked at the progress somebody can make if they just are continuous with it, just keep up with it. I have had several people who were told by doctors that they'd never walk again. But because of their determination and their desire to get better, they did. And I hear those stories all the time. And I would just say, don't give up on yourself and just keep doing one thing at a time. And so, um, yeah, thank you for joining. Hope you found this helpful. Feel free to reach out if you ever have any specific questions or whatever, like to have a virtual consultation. And I will see you later.